Welcome to Kaumudy Global. If you are a person who likes to sit before your laptop for hours or you are compelled to sit as you are working, please find time to get out of your chair. A new research by Simon Fraser University is adding further weight to the argument that prolonged sitting may be hazardous to your health. An international study surveying more than 1 lakh individuals in 21 countries found that people who sat for 6 to 8 hours a day had a 12 to 13% increased risk for early death and heart disease, while those who sat for more than 8 hours daily increased that to a sobering 20%. The study, co-led by Simon Fraser University, Health Sciences Professor Scott Lear and Wei Li of Beijing's Chinese Academy of Medical Sciences, is published today in the journal JAMA Cardiology. Their research followed individuals over an average of 11 years and determined that high amount of sitting time were associated with an increased risk of early death and also cardiovascular disease. While sitting was problematic in all countries, it was especially so in low-income and lower-middle-income countries. The overarching message here is to minimize how much you sit, says Lear. If you must sit, getting in more exercise during other times of the day will offset that risk. Not surprising, those who sat the most and were the least active had the highest risk, up to 50%, while those who sat the most but were also most active had a substantially lower risk of about 17%. For those sitting more than 4 hours a day, replacing a half hour of sitting with exercise reduced the risk by 2%, Lear noted. With only 1 in 4 Canadians meeting the activity guidelines, there is a real opportunity here for people to increase their activity and reduce their chances of early death and heart disease. The study found a particular association in lower income countries, leading researchers to speculate that it may be because sitting in higher income countries is typically associated with higher socio-economic status and better paying jobs. Clinicians should focus on less sitting and more activity, as it is a low-cost intervention that can have enormous benefits. But while clinicians need to get the message out about countering sitting with activity, individuals need to better assess their lifestyles and take their health very seriously, Lear added. Our study found that a combination of sitting and inactivity accounted for 8.8% of all deaths, which is close to the contribution of smoking. It is a global problem that it has a remarkably simple fix. Scheduling time to get out of that chair is a very good start. I am Shreya signing out. Please subscribe to our channel and press the bell icon to get the latest updates.